Assalamu alaikum wa rahmatullahi wa barakatuh to everyone who's watching. May Allah bless you all for tuning in on this very special stream we have set for you all. Alhamdulillah, coronavirus and Ramadan. We have a special guest with us. We have the junior doctor, Dr. Usman, Dr. Muhammad Usman with us. My name is Muhammad Mahfouz. I hope you're well and the best of health, the best of Iman. May Allah bless you all for tuning in on this special stream. As we're very short of time, very limited on time, we are going to crack on with this meeting that we've got arranged, set with our Honourable Doctor, Dr. Muhammad Usman, inshallah ta'ala. And as soon as we've linked with him, we'll join with him, inshallah ta'ala. And I have him on the line now, so we'll crack on with the meeting. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
How are you, doctor? You well?
Alhamdulillah, I'm very well, brother Mahfouz. How are you keeping?
Alhamdulillah. Jazakallah khair for taking time out of your busy schedule. We all know that the doctors, NHS staff are working around the clock, working long shifts, long hours, mashallah, to be blessing us with your words of wisdom, and inshallah, especially more with your advice that we'll be receiving in regards to the coronavirus. So how are you keeping anyway?
Alhamdulillah, I'm very well. I'll actually be starting work in a few months' time. I mean, as finally as we've completed. So inshallah, I'll be starting as a junior doctor in a few months' time. It may still be during the coronavirus episode at the moment, but I'm happy to be of some help anyway at the moment. Even if we've not been taken to work on the front lines yet, but alhamdulillah, I'm glad I can share anything and try to be of some benefit to yourselves today.
MashaAllah. So we'll crack on straight away with these very important questions I've been receiving for the past since yesterday when I put the message up that I'm going to be doing this myself. I've been receiving lots of messages via WhatsApp and other media outlet platforms. So the first question I'll crack on with is the most common one that I'm sure you've given advice to those people is what are the symptoms for coronavirus?
Sure. So the main symptoms that we've been warned about from the government, the NHS, are things like a new continuous cough, particularly if it's quite frequent and it's going on for more than a few days. A high temperature that's going on for a few days as well.
So in terms of high temperature.
Yes.
What's the threshold that they have to look out?
So some people are having quite high temperatures. We're talking up to 39 or so. Some people are just kind of having lower temperatures around 38. It's actually with coronavirus, because it's still so new, it's very strange. I was speaking to a senior colleague yesterday about this, and he was mentioning how some of his junior doctors actually had symptoms like loss of taste and loss of smell, which are actually recognized as symptoms of coronavirus. So I know the NHS guidelines are that, if you have, a cough or a new high temperature or generally feeling really quite unwell, you may well have coronavirus and stay away. Actually, the symptoms are a lot wider than that. Things like loss of taste and loss of smell. And different governments and different healthcare systems around the world are using different criteria for this. The main advice being, if you stick to the official guidelines, inshallah, that should kind of keep you safe and keep others safe, and you'll know to stay away from others.
MashaAllah. And these symptoms, will they just appear just like out of the blue, or does it take a while for it to show? Or this is another question as well. And how long would it take for these symptoms to show? Or does it show or doesn't it show?
Yeah, so this, again, this is because it's a new virus that's come up. People are still not sure. Different healthcare systems are saying different things. What we do know is it can take anywhere from 1 day up to more than 20 days actually for the symptoms to show. For some people, they'll get all the symptoms. For others, they might get a few. For some, it'll come on immediately. For some, it may take a few days. It may not even come on. So this is, people have been asking as well, why are we in lockdown? Why is all this going on when, it's this virus that no one can really see, and, that might just give you a cough. The thing is, a lot of people might just have it and with a few symptoms, and so it can spread very easily amongst the people because of this. Yeah, and, kind of what we know is the majority of people won't have very severe symptoms. It might just be the cough, or it might just be feeling very achy and tired, or having the medium high temperature. Of course, we know in the community a lot of people have been passing away because of this. We know personally people as well who've passed away because of this, and that's maybe anywhere from 10 to 15% of people who are ending up in hospital, and of those, a few people are passing away. So it can be from very mild all the way to very severe.
Well, so the people that have these symptoms, do they need to go to the doctors, go to the hospital? Do they need to, or do they call 111 or 999, or what do you think they do?
Yep. That's a very good question. Understandably, I think people are very anxious at the moment of what to do. As the government has been broadcasting out on all of the news channels, and I think if you go on Google or on YouTube as well, there's a lot of ads at the moment, and they've been mentioning to use this coronavirus 111 website. So I think if anybody wants to access it, just typing in 111 coronavirus or NHS coronavirus. And there's a very clear link to it. And it's a website that it'll kind of check through a few of your symptoms if you're worried, and it'll let you know whether to, call anybody, whether to call your GP, whether to, call an ambulance or to stay put at home. For the majority of people, if you're not struggling, if you're well at home, if you're controlling your temperature, if you're controlling your cough, or the shortness of breath isn't affecting you that badly, it's better to stay at home. However, if people are struggling in any way, shape, or form, and this is the advice given on the website, or if you're somebody who's in ill health generally and there are worries, there's a lot of advice on who to call on that website. And so the majority of people shouldn't really be calling doctors and so forth, because as I'm sure you're aware, and we're seeing on the news outlets, that the hospitals and indeed other healthcare providers are quite overburdened at the moment. And it's important to note that if you can manage at home and using the resources that the government is encouraging, that the NHS is encouraging, that's the best thing to do.
Before we go on to
yes,
this thing about medicine,
yeah.
There's this thing going around. This is my next another question actually. Is it true that if you go to the hospital, that you're going to come back dead?
No, that's not true. I actually went to a major hospital yesterday. I'm still alive. I'm with you. Alhamdulillah, I'm talking here. The people who go to work at the hospitals, they're going in, they're coming back, they're still alive. Our Prime Minister, Boris Johnson, he was in hospital, he's back and he's alive. I think actually...
I think what the system is referring to is that if you go to the hospital, coronavirus symptoms, they keep you in there and they drug you up, or I don't know what they do there, but the Asian community, from what I've seen various people saying, but this system particularly asked me to ask you this question, that look, a lot of people are coming back dead or something, or is it just this rumor that's going around within the Asian community?
Yeah, I think we have to remember, look, this is a very testing and challenging time. And in these times, all the fake news that's usually spread around WhatsApp and the social media websites, it becomes even more. And, and we're in this kind of panic state, if you want, a lot of people, and it's understandable. If you're not medically trained or you don't have this know-how, a lot of this can be quite new and quite worrisome. I think one of the main takeaway messages that I'd like to share with everyone at this point is just to be aware that, especially in this current day and age, probably 99% of what you're being, what you're hearing, what you'll be receiving over WhatsApp is may well be fake news. It may well be people looking to stir panic or trying to make some money or instill fear in people here and there. The best advice would be to stick to, official links, official websites. I think we've included a few at the bottom of this YouTube video as well. Things like the NHS website, your main news channels like your BBC or trustworthy news sites who will be keeping updated. The statistics actually show that the majority of people who get coronavirus and go to hospital are coming back well. I think, if you're following the news, there's very, very good statistics out there. Not many people who end up in hospital are passing away. Statistics. I couldn't give you a percentage at the moment. It just varies from country to country and people who are ending up in hospitals. However, people who go to hospital, they get different therapies and treatments when they're there. Some people just need oxygen from a normal mask. Some people need a special type of mask to give them oxygen. Other people might be needing things like, the medications to make them asleep and have tubes for oxygen. It just depends on the severity of the illness. But for the majority of people, they're not at that highest level of treatment. And most people are coming back and they are recovering and they are well. And again, this is something I have to stress, to stick to the official, news channels, official NHS websites, because that's where you'll get the real information. There are, and I get some of these fake kind of news videos as well that X, Y, and Z is happening. That if you go, you'll come back with this, or that certain vaccines have been designed to give you this coronavirus, or they're hiding away treatments, or they're doing this for one reason or another.
Just to interrupt you, Doctor.
Yes.
There's this rumor going around about 5G, the 5G and how it's linked to coronavirus. What's your opinion on that?
Look, as far as I know, and I've read a bit of this, I've heard these rumors as well. There's nothing, to show that it's 5G causing this, or 5G has anything to do with it. Like, people love a good conspiracy theory, especially in times like this. Some people are saying it's the 5G. Some people are, saying that America cooks it up and sent it to China or whatever, whatever it might be, that it's designed to kill a certain ethnicity or to kill certain. Look, what we have to remember, and especially as Muslims, I think we can appreciate this. Look, whatever it is, it's here, and Allah subhanahu wa ta'ala, with his power and might, has allowed this to occur. And we have to remember that nothing happens without the power of Allah subhanahu wa ta'ala. So whoever it is, whoever's cooked this up, for us as Muslims, we shouldn't actually, worry about that or be concerned with those theories. As far as I know, there's no evidence out there that this is caused by anything like that, or that or that Chinese people. I know there's been, some extra racism and fear of, Asian, Chinese people, that they're carrying it and spreading it everywhere. I think we need to stay calm and as much as we can be, and try to just stick to these official, trustworthy information sites. Yeah.
And that goes to leads to my next question, actually. The one before the conspiracy thing. Ibuprofen. People are saying that ibuprofen can damage you more than anything. What's the medical thing say about this?
Yeah, so the NHS, I think in the last few days on their website again has released a bit of information about this, because understandably people are very worried. I think there was maybe a very small trial somewhere or some suggestion. I think a politician from France maybe had suggested that ibuprofen is causing patients to come to more harm. The official evidence at the moment suggests that there's nothing of that sort. What the NHS is saying is that use paracetamol first of all. If that doesn't help, ibuprofen, if it's safe for you to take, it should be okay. Again, if you're somebody who takes it for a particular medical condition, do contact your GP and ask them, should I continue, should I not? Again, just to take cautions, but not to be sucked in that it's into the myth that it is causing people to pass away. At the moment, that's the current evidence, and that's what we should stick with.
MashaAllah. Right.
Yeah.
Very another question a brother actually sent is, how can one protect themselves from the coronavirus? For example, he was saying like washing hands. If it's like how should we wash our hands? How often should we wash our hands? And like should we be wearing gloves on? masks on, and
Mhm.
all these other things as well.
Yeah. Okay. So I think in relation to that question, it'd be quite helpful to understand how coronavirus actually spreads between people. So coronavirus, like a lot of other viruses, things like the common cold, all these things, they're spread when you come near an infectious person and they're either talking or coughing or sneezing, and very small, droplets and particles are actually spread from that person to the surrounding area. And if you're there, you can catch it through, your eyes or your mouth or your nose when you're breathing in or in the vicinity. Um, so things like keeping a 2 meter distance, which is what the government's suggesting, or even more, however much distance you like, but a minimum of 2 meters, ideally, is kind of the reasoning behind that is so that if someone is talking, they're infected, and there's droplets around them, you're keeping a safer distance. Okay, this is why you'll notice when you go to supermarkets now, they've got those lines marked out to keep people distance. Why? There's only a certain amount of people going in and out. It's to maintain a small distance between people so that this form of spreading doesn't occur. The other thing being washing your hands very, very frequently, as frequently as you can, especially, if you've gone outside, you're coming home, wash your hands. Warm water and soap is good for at least 20 seconds, rubbing your hands. This is how we, wash our hands in hospital when we see patients. If you've been around a patient, whether or not you're using gloves and aprons or just your hands, you would go to the sink, use warm water, soap, rub for 20 seconds. There's numerous videos out there on news channels, on the NHS website, how to do this properly. And as Muslims, we're making wudu multiple times a day. This shouldn't be, unfamiliar to us, washing your hands properly and frequently. Things like covering your mouth or your nose with your elbow or with a tissue, if you have, preferably, or if you're coughing or sneezing, binning those things immediately, washing your hands straight after that. If you're going to prepare food for somebody or do things like this around the house, washing hands before, washing hands afterwards, just as frequently as you can. I think there was a bit of a scare at the start of lockdown about hand gel and hand sanitizers. Everyone going crazy and the prices going through the roof as well. Ordinary soap works just fine. I think people have kind of been sucked into this idea that it has to be hand gel because it's antibacterial. What we have to remember is coronavirus is a virus. It's a different type of organism or creation to bacteria. And just using normal soap and water for 20 seconds, it breaks down the virus. And that's all you'll need to use. So I think people have been investing in, hand sanitizers and doing these things. And actually, it's better than nothing. Yep, that's true. But I think a lot of people just think that putting a bit of hand sanitizer in your hand will kill the virus. There's actually, a proper method to washing your hands with hand sanitizer and doing it for a certain amount of time. And so I think we just have to, stay sensible, use these precautions, and not get into the mindset that just having hand sanitizer or gloves or a mask will help you. I think you mentioned about using gloves and masks as well, Brother Mahfouz. And I've seen a lot of people actually walking around the streets with kind of gloves and the surgical masks on. And I have to tell you, I've been in a lot of surgeries as well as part of my training. And the main reason for wearing one of those simple surgical masks is actually to prevent you from coughing or breathing anything into the patient. If someone's got the tummy open and they're having surgery done, you don't want to be spreading anything into them. And that's their kind of design to stop, things like your beard or anything like that falling out. They're not very good at, protecting particles, coming in the air, and if you bring them in, for example, a virus. And I was reading an article earlier today, actually. The government's kind of, still deciding with its advisors whether or not to recommend this use in the public. Some people will have seen around, certainly in England or around the world, you'll see images of people wrapping cloths around their mouths or putting different masks on, things like this. Different governments have given different guidelines. And one of the worries is that if people are buying up masks, it leaves less for hospital staff as well. And I think maybe in the next few days, we might hear something on the main news channels about this, what to do. Better than wearing masks, again, just keeping distance, being sensible, only going out for absolute essentials, washing hands frequently. I think one of the bad habits we have as people in general is touching our faces and mouths frequently. Again, trying to make sure you've washed your hands thoroughly before you touch your hand, your face or your mouth. I think one of the other issues is that when people put gloves and masks on, they suddenly feel invincible. I mean, I think this would probably be fair to say, you see people, I've seen strange things, people with masks on and smoking cigarettes right next to each other outside shops, and very strange things going on. And people forget that actually this virus, it can come and live on your mask. It could come and contaminate your mask or your gloves. And,
so, like when like people smoke and when they blow that smoke out.
Yeah.
Could there be like vapors within that smoke where another person can inhale it? Could that be a way of passing that virus onto another person, do you think? Or?
I mean, as far as I'm aware, I couldn't give a comment on that. The main thing being just to keep distance from people. And if you're worried, stay further away from the city. But I'm not sure there's any evidence out there or anything that we've been told. But if people are wanting to use gloves and masks, the main thing to remember is it's the gloves and masks themselves are not going to protect you from getting the coronavirus. It'll stop it from going onto your hands, maybe, if you've got the right gloves on. And with the mask, as I've said, the normal surgical masks that people are wearing, they're really not, extremely effective if you're around someone who's infected. It might stop you from spreading it if you have it. And I see a lot of people with those special respirator masks as well. I think there's different types, the N95s. Those are quite effective when they're, properly fit tested. A lot of NHS staff have been, properly tested and it's fitted to them. And then it's kind of, very 95% effective.
Do you have to change?
However,
do you have to change the filters on them?
Again, it's not something I've been taught how to use. I'm not sure on their use, and it's not something that's being advocated by the government. I think even in hospitals, only staff who are in very close proximity with patients who've got coronavirus and who are very infective, and in particular procedures, and they've been taught how to use them properly. And actually, I was reading an article that, the reason that some healthcare staff are still being infected while wearing these masks is it's actually you can catch it when you're taking everything off, because people become a bit lax, when you're taking it off and they'll start touching themselves around the mouth and not taking precautions. Again, for us as the general public, I think, those steps the government may or may not advise, but the main thing is to keep distance, stay at home, frequent hand washing, covering yourself when you're coughing, sneezing. The simple things will protect people. Yeah, I hope that's been helpful.
Yeah,
that's a lot better.
It's very helpful. When should you take the mask off? So that mask that you wore on and you're outside.
Yeah.
Like say you've coughed into that mask and you still got that mask on, or when should you dispose of that mask or could you reuse that mask again and again?
No. Okay. Yeah. So these masks generally they're single-use masks, and I would say if you're going to wear it when you go out and about, as soon as you're coming home or before you enter your home, get rid of it and wash up properly. Don't keep it on because it could be contaminated. You could bring things into your home. It's not something that you can keep wearing, and they're very easily contaminated, and so you have to get rid of them. Yeah.
In terms of get rid of it before your house, does that mean throwing it onto the pavements, onto the road, or?
No. I'm not advocating litter, but if you ever been outside the home, a lot of us have garbage bins. Chuck it into that.
The reason why I said that obviously is like now, like if you go onto the outside, you go anyway, especially in the Asian populated areas or the ethnic minority populated areas. You see like gloves on the floor, you see masks on the floor, like the wind around. It's horrible because that's causing more contamination possibly, isn't it?
Yeah. I think people have to remember, look, if you've gone around and you're wearing those gloves and that mask, that could well have coronavirus on it. It could have other contaminants on it. If you leave it around and about, you're posing a very significant risk to other people. And I think, look, if you're going to wear it, you have to have the responsibility that you'll dispose of it correctly as well, because otherwise, we're causing problems to other people.
Another question that I've just received is Fairy Liquid effective when washing your hands?
Yes, I think Fairy Liquid, it's got the same kind of soap agents. It works in a very similar way. I mean, I wouldn't really advocate it for hand washing. It's it's quite strong, and it is obviously designed for washing up your dishes and things. And if you're for washing dishes, as far as I'm aware, the advice being continue using warm water, Fairy Liquid, just clean them for that 20 seconds if you can, make sure there's a lot, you've got that soapy kind of froth and it's fully covered and you're washing them properly if you're worried. But for hands, just ordinary bars of soap and just using the right techniques, making sure that I think they were saying sing happy birthday twice, right? While you're washing away, or 20 seconds, whatever is easiest for you. But making sure when you do it, that you cover both sides of your hands in between your fingers, over and around your nails. Us as doctors, we're taught very strict and special methods to hand wash. And I don't think it's a bad thing if people do that as well, especially in today's day and age, just to be more cautious.
Mashallah.
Yeah.
And another question is,
yeah.
Who is most at risk?
Yeah. Okay, that's a very good question. It's a very, very good question. I think, what we've been told in the last few weeks is generally people who are elderly, say over the age of 65. They might be frail, weak, have other health conditions like heart conditions, high blood pressure, diabetes especially. Anyone with any lung conditions, so things like asthma, or they've got COPD, which is usually something caused by smoking, or any lung condition. I think people will know, if they have these conditions. And I think the government had made a push to send out letters to people who were high risk. But generally speaking, people who are over the age of 65, they've got those health conditions as well. And especially so people who've had things like cancer treatments, people who've had things like bone marrow transplant. I think there's a very, good and succinct list that's available on the NHS websites and things like the news outlets. Again, if you just look at the links that we've posted below this video for people to look into for more detail. One of the other things that's been emerging in the last few days, I think we've all noticed that some of the NHS doctors who've passed away, they've been, from the Asian or Middle Eastern Arab backgrounds, if we've seen that as well. And, a lot of people who are passing away, patients, they are from these backgrounds. The government and the NHS are not quite sure why this is, but they have kind of stated that, yes, this is something we're seeing, statistically speaking, that people from our Asian, African, Middle Eastern backgrounds do seem to be getting more affected by coronavirus. The jury's out as to why this might be. This could be because, we as a population don't look after our health so well. We have got, and I think everyone knows at least somebody who's got diabetes or a heart condition or a lung condition or whatever it might be. And unfortunately, a lot of the doctors who've passed away because of coronavirus in this country, you'll have noticed, they're from, countries across Africa or from Pakistani, Bangladeshi backgrounds, whatever it might be. So I think for us as a population, we have to remember if they're elderly, or even if you're young and you've got, a long-standing health condition, we'd consider ourselves, at high risk. And especially so, your kind of grandparents demographic, people, pushing that 75 and above age group, and they've got a lot of health conditions. Those are the people to really be aware of.
Mashallah, that's all the questions I have so far on the coronavirus thing. Now we go on to the Ramadan bit now, mashallah.
Okay.
So Ramadan is either some people are going to be doing today, doing the first Tarawih today. Yeah. Some people will be doing the first Tarawih tomorrow, whichever they do it on. If you've got the symptoms of coronavirus, for example, like you got the loss of taste, smell, or whatever, and you've still been advised to stay at home because you're not too ill to be going to the hospital. Could you get advice from your doctor, your GP, to say, look, am I well enough? Especially like if you've got diabetes and other illnesses which can limit you fasting, basically, innit? Upon the doctor's advice. There's a lot of elderly people, like especially in my house, like my father, he's diabetic as well. He's been advised not to fast. Every time he's fasted, he always either passes out or his sugar levels go so low that going low is it's quite dangerous. So, do you think instead of not fasting yourself, you should get advice from a doctor, a professional doctor? Like, what advice would you give to people in that respect?
Yeah, I think us as a Muslim community, again, we like to take things into our hands often, and we can be quite stubborn sometimes, especially if all our life we've fasted and now suddenly we're at a certain age, we've got health conditions, and we find it difficult. I think for everybody out there who has got medical conditions, and you're on certain medications, I think the best thing that everyone should do, and people usually do it year by year, is to call up your GP, whoever it might be, if you've got any concerns, and ask them, look, I'm on these medications. The fast is going to be this long, from this time to this time. Can I fast? And I think that's on a case by case basis. Some people could take their medications at the start of the day before the fast, and they'll be fine throughout the day. Other people, especially a lot of diabetics, they need medications throughout the day, and if they were fasting, it could affect their sugar levels. And like you said, your own father, the sugar levels can drop. And we're taught in Islam as well that if it's something that's going to be impinging on your health, even if it's a father, it's something that can, forego. I remember in, say, Sheikh Fadi's class once, he mentioned about one of the companions who had a cut to his head, and he was bleeding. And yet some of the companions told him, go make wudu and pray. And he passed away because of that. And the Prophet cursed them because of that. And, that you killed him, actually. You should have sought advice. And there are a lot of dispensations out there. And I think people, need to remember that Islam is very accommodating, especially when it comes to health problems. For women who are pregnant, for example, and you've got a child inside you, and you need that nutrition, for example, or you're breastfeeding, or whatever. There's a whole number of medical and conditions, and I think people really should speak to their GPs who know their backgrounds, who know their health very well, and take a decision based on that. Yeah, and in conjunction with that, to speak to whoever the local scholar is and tell them, look, this is the advice I've got from my GP. What do you think as well, and make their decisions based on that.
Alhamdulillah. Also, Sidi, diet recommendations. I know it's Ramadan. People always say, I want to lose weight. Me being the number one culprit, but at the end of Ramadan, we see that we gain more weight. So, in terms of like suhoor, for example, and iftar, what kind of food should we be looking out for? What types of food should we be eating?
Yeah, sure. Just coming back to your previous question, I just had an idea that came to my mind. I mean, you mentioned some of the symptoms of coronavirus, loss of taste and loss of smell. I think that'd probably help you to fast a little bit easier. You won't be worrying about food or drink throughout the day. But if just like any other Ramadan, right? If you have like a very light cold, people will often fast through it, right? It's not a big deal. If it's something very severe and, you're too weak to get out of your bed and you're really very ill, I think people usually kind of know that, fasting, if it's going to make things worse, I think, again, this is something that to discuss with your local scholars. But generally speaking, if there's something that's going to worsen your health condition, we're told, don't do it. And there's dispensations as well, various dispensations of people who for example, wouldn't be able to fast that day to do it, another time or pay whatever it might be. And I think if people have got very mild, symptoms like a very light temperature or a very light cough or whatever it might be, it's fine to fast. I think, in previous Ramadans gone, I've had things like, the colds might go around or those coughs that come, and you can still fast with those. But I think it's just understanding that there's degrees to it. And just because coronavirus is out there, doesn't mean that we shouldn't be fasting.
And in terms of the suhoor and iftar,
I think I'm going to make a lot of enemies, I think, now at this point.
I'm not going to be one of them.
Look, I think first of all, to just mention some of the very significant health benefits that fasting brings. I mean, look, the Prophet ﷺ would not have told us to fast, would not have given us this fasting if it would not be healthy for us, if it's not for our benefit. Everything we do in Islam is for our benefit, whether we realize it at that point or not. And there's numerous scientific studies that have come out recently, showing that fasting, especially the type of fasting we do, all they can, if done properly, do things like lower your blood cholesterol. It can help to strengthen your immune system, which is something that we could all do with in today's days with coronavirus. And have a lot of very good health benefits. Help re-strengthen your body, and especially lower weight for people who are struggling with that at the moment. So I think that's one thing we have to remember, that actually fasting is a blessing if we do it properly. Now, in terms of the eating and drinking, look, what I've heard from some of my, Islamic teachers, and you know Habib Omar as well from Yemen. I heard from one of my teachers that all they do is they just open their fast at iftar time with dates and water, and that's all they'll have. And I think one of the main things to remember at iftar time is to follow in that sunnah of dates and waters and keep it light, because you've got Tarawih prayers to pray at home, you've got worship to do at night time. Your body's been empty of food all day, and imagine you're suddenly going to overload it with these deep fried pakoras and samosas and the curries and everything. And I think if you just think of it in a logical way, that it's been empty all day, and actually you're doing fine. You might be a little bit hungry, you might be a little bit thirsty, a little bit tired, but that to then go and completely fill yourself up, you're gonna, all of your body's energy and blood is going to be diverted to your stomach. And
on that one, Sidi, there's this thing that some people are saying that you shouldn't drink cold water during iftar. Is this true? And if it is true, why would they say that?
As far as I'm aware, there's no kind of solid, medical benefit or not. I think there's hypothetical evidence that if it's cold, it can take longer to digest, or it affects it might affect your organ imbalance. I think, if people like things a bit cold and it's a hot Ramadan, as far as I'm aware, there's no adverse health effects that have been noted. And if we read the Shama'il of the Prophet ﷺ, he used to enjoy sweet and cold drinks. Those were his favorites. Things like water with raisins soaked in them, or things like cold milk. And I think people just sometimes need to take these things maybe in moderation. It doesn't mean take something straight out of the freezer and drink it ice cold, because then you'll get brain freeze anyway, and it's not really that pleasant. But neither are we saying everyone should be drinking room temperature things. I think, look, just keeping things in balance. And it's very interesting. One of my teachers, he mentioned that traditionally people would, when they were eating, they would chew their food the same number of times that they had the number of teeth, right? So if they had a date, they would chew it until it's digested. And especially we're talking in the fasting times. And from a medical perspective, when we eat food, our body has a system of hormones to let us know whether we're full or not yet. And it takes a bit of time. It varies from different people. It can be anywhere from about 15 minutes to 45 minutes before your stomach and your digestive system tells your brain, okay, we've had enough food, stop. And I think, look, subhanAllah, there's wisdom in that, chewing your food, taking your time to eat, which is what we've been, told by the Prophet ﷺ himself, that there's significant medical benefit too. If you do that, your body will tell you that you're full sooner than if you were to eat very quickly.
Is that saying to you that you can eat yourself to death? Is that true? If there's hormones that are not working properly and not sending the right messages, you can eat to death or something like that, or eat yourself to death?
Well, for some people it's true. Some people, the hormones that tell your body that you're full don't work properly, and that's a medical condition. But I think for a lot of us, we eat very quickly, and so we've filled ourselves beyond our capacity. We're told at most by the Prophet at most to fill ourselves a third of food, a third of water. And I think people say a third and then they go kind of a couple of thirds over that. And definitely, when we talk about eating yourself to death, look at our community. People, a lot of people are very, beyond the weight that they should be. Overweight. They've got, diabetes. They've got heart conditions. They've got high cholesterol, and these are things that you could basically correlate to having to eating yourself to death. And then we get all sorts of health conditions, and people in their elderly age, they can't stand to worship, or they can't, they become very infirm. And I think for sure you end up eating yourself to death. So I think, in terms of, I'll come to what is better to eat, I guess.
We've only got I think we've only got like 2 minutes left.
Okay, fine. So if I was to say, in summary, at iftar time, keep things simple. Stick to your, dates, your light kind of drinks, waters, milks. Try and avoid things that are very heavy and fatty and too rich, because you divert your body's energies to digestion rather than to actually using that energy to give you energy for worship. I've included, I think, a link just below the video to a government nutrition website, which has got some very good information. I think what a lot of my Islamic teachers, and from a health perspective, we'd recommend is eating more at Sahri time. Using iftar time just to eat the light dates, fruit, have a lot of water, and then at sahur time, eat enough to keep yourself full for the day of if you're working or whatever it might be. Just try to avoid as much as you can all this heavy, rich, fatty foods that we do, the curries, the salty foods, all these things. It taxes your body a lot. It'll dehydrate you. And just remember to do exercise if we can in Ramadan, whether it be a short walk with the family before iftar or after sehri or after iftar, whenever it is, but just to remember to keep things in balance.
MashaAllah. Jazakallah khair, Dr. Muhammad Usman, for this very knowledgeable, knowledge-enriched interview. Alhamdulillah, may Allah bless you, especially for taking time out from your busy schedule to be blessing us. Many brothers and sisters have put lots of messages on the Facebook live stream. We have Usman Ghani, Yusuf Chaudhry, Farzana Dar, Ahmed Karela, Ishtiaq Ahmed, Seima Rafiq, Abid Aziz, A Chaudhry, Ifat Tahira as well. I'm sure you know most of these people. May Allah bless them all for tuning in, and inshallah ta'ala, we pray that Allah keeps everyone safe from this disease, this illness.
Ameen.
And Allah blesses us all during the month of Ramadan to before we've got a message from Jibreel Chinia as well, mashallah. That Allah blesses us throughout the month of Ramadan and we can observe, even though we've got all these distractions such as coronavirus and all these other things, that it doesn't really distract us from the true essence of Ramadan, inshallah. And again, we thank all the viewers for tuning in. We've had lots of viewers, alhamdulillah, throughout this stream. We've tried to keep it nice and short, and the questions are your questions. The viewers, mashallah, you've been giving all these questions throughout the program and before the program. We bless Dr. Muhammad Usman for blessing us again, and hopefully we might have you on during Ramadan.
Yeah, inshallah, if I can benefit in any way, or if anybody wants some healthy recipes, we could always do something.
And all the information that Dr. Usman has given is in the descriptions box below. So all the websites and all the relevant information that everyone needs to know it'll be all found there, inshallah ta'ala. And inshallah ta'ala, may Allah bless you, Sidi, for taking busy time off from your schedule. Alhamdulillah. So Allah bless you all, dear viewers, for tuning in, and hopefully we'll no doubt have Dr. Usman on a later program. Bismillah ta'ala. Do stay safe, do keep the ummah in your du'as, and try to help the needy people in your locality. Lots of people are going through poverty now in the United Kingdom, in America, in Europe. Also, there are people who are going through extreme poverty in the Asian subcontinent, for example, India, Pakistan, Bangladesh, where the poor, they're not dying of diseases, the poor are actually dying of not eating anything at all. So it's our Syria and Yemen as well. So it's our responsibility as people that Allah has chosen to be living in these lands, earning good money, alhamdulillah, that we should be at least sparing £5, £10, either putting in a jar or a pot and then trying to send it to these people who need it. May Allah bless you all and grant us all the tawfiq. And with that, I take leave, dear viewers. Do stay blessed and do keep me and the whole ummah in the du'as. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.